I'm Dr. Adam, a naturopathic doctor, and I help men rebuild their health. So not just to manage diabetes, but to reverse it completely. And today, I'm going to show you the 5 metabolic patterns that I've seen in type 2 diabetes. So how to recognize them, what's driving them, and then how you can finally target the real problem instead of guessing your way through, another year of meds and disappointment. But when you actually sit across the room from hundreds of men with the same diagnosis, like I have, you see how differently it plays out. So some guys are gaining weight no matter what they eat. Some are lean, but still insulin resistant. Some guys are just crushed by stress and they have brutal sleep deprivation. And then at that point, it hits you that the label of type 2 diabetes doesn't tell the full story. Let's say you're about to head to work, but your truck doesn't start. Well, you wouldn't just keep adding gas and hoping for the best, because sometimes it's the battery, sometimes it's the starter, sometimes it's a clogged fuel line. The symptom might be the same, the truck doesn't start in any of those, but the reason why it's not starting is completely different. That's how we treat diabetes. We keep adding gas, another medication, another diet tweak, another visit to a specialist, hoping that something works. But when you treat the wrong cause, you can't fix the problem. You just manage it forever. That's what medicine has become, a guessing game of, let's throw more parts at the problem. And when I realized that, that's when I stopped treating type 2 diabetes as a single disease and started looking at it for what it really is, which is a collection of unique metabolic breakdowns. And each one of these is driven by a different system failing first. There's a landmark study published in Nature this year that measured glucose response to the same foods across 55 people using a CGM, a continuous glucose monitor. And what they found was pretty fascinating. So the same exact meal caused completely different glucose responses from person to person. So one guy's blood sugar barely moved after eating bread while another's spiked through the roof. And thinking about this, I'm like, of course it does. Of course that's going to happen. That makes sense intuitively. But the crazy thing is we still treat everyone like they're the same, like everyone will have the same response to the same food. Well, another study defined this nuance from person to person as, quote, wide inter-individual variation in glycemic and behavioral responses, which is a mouthful. So in normal language, that means your metabolism, your gut bacteria, your stress levels, and your lifestyle, all of those things are unique to you and they change how your body handles food. So no two people do it the same way. So if you've ever wondered why your doctor's advice maybe worked for your buddy, but it doesn't work for you, well, that's why. Because your version of diabetes might not be the same as his. And once you see that, you can't unsee it. So here's the key idea. A metabolic pattern is the specific way that your body is breaking down. It's the fingerprint of your dysfunction, the unique sequence of systems that failed and led you here to this diagnosis. These patterns explain not only how your body handles energy today, but which part of your metabolism started struggling first years ago. So when you identify your pattern, you stop guessing. You know exactly which lever to pull. Is it your muscle, your liver, your pancreas, stress response, or is this your fat tissue that's the problem? And you can often see that pattern clearly in your CGM data. How your glucose moves throughout the day tells us the story. So for me, that's where real reversal begins, because once we know what's broken, we can fix it in the right order. So here's what I look for in your data. So it's 4 main clues to spot your metabolic pattern. The first one is your fasting baseline. So what is your liver doing overnight? Second pattern is related to post-meal spike. So how well your muscles and your pancreas handles glucose after you eat. The third is response to starch versus sugar. This was reflected in that study. So whether this is insulin resistance or beta cell fatigue, it's a pancreas issue. Number 4 is how you return to baseline. So how quickly you clear glucose back to normal. So those 4 patterns, in a sense, tell me the language your body's speaking. So once you understand that language, you can read diabetes like a roadmap. And man, I'm telling you, that's a good way to move from managing this disease to reversing it. And I've heard researchers call this the ominous octet. So 8 systems in the body that can malfunction and then lead to diabetes. But in my practice, I've seen 5 dominant patterns that capture how this disease really shows up in the real world. And they're not rigid boxes. Most men are a combination of 2 or more, but identifying which system in general failed first gives us our starting point. So let's break down these 5 patterns. So number 1 is muscle dominant insulin resistance. This is like an inactive engine. And here, fasting glucose looks okay. Maybe it's 85, 105, but after you eat, your glucose spikes hard, and then it takes forever to come back down. And what's happening is your muscles have become insulin resistant. So they're not pulling sugar out of the blood efficiently anymore. And that usually happens when muscle mass drops, or maybe you're moving less than you think you do. The problem here isn't that you're overweight, it's that you're under muscled. So to fix this, you need to lift weights. You need to prioritize protein. You need to move after meals. The goal is to retrain your muscles to burn fuel again, so they're active even while you're sleeping. Some common pushback I hear after telling someone to strength train is, well, I walk every day, or my job is physical. And I think that that's good. Keep walking, obviously, keep moving at work. But neither of those is enough to build muscle to reverse insulin resistance and diabetes. So you need resistance, you need more time under tension. And ultimately, you need balanced strength training. All right, the second pattern in type 2 diabetes is liver dominant insulin resistance. So I think of this as like a leaking fuel line at night. And what it looks like in data is that you're starting the day with high fasting glucose. It could be 130, it could be 150, and as high as in the 200s as things progress. But meals during the day don't seem to cause like this major spike. And what's happening here is that your liver is stuck in release mode. So you're sending out glucose overnight like a leaking fuel line, and that's usually caused by a disrupted circadian rhythm, or it's caused by drinking alcohol at night, or maybe chronic stress. And if this is you, you need to fix your timing. So you need to eat dinner earlier, prioritize deep sleep, get movement in first thing in the morning before eating anything. That's what retrains your liver's rhythm. The third pattern is beta cell dysfunction. This was really the turning point for me learning about this that led to me researching different phenotypes. And so you could think about this as the fragile pancreas, and it really does not present as the most common type 2 diabetes. It's in a class of its own. Because what this looks like is that you could eat the same meal as someone else and your glucose shoots up to 200 while someone else's barely hits 140. And then your blood sugar stays elevated for hours. And what's happening is your pancreas has lost its first phase insulin response. So the quick burst that keeps post-meal spikes in check. So your pancreas is overworked. But that's good news because it doesn't mean that it's broken. So you can recover from this. And this is how you do it. You got to simplify. You have to eat consistent meals, same time daily with balanced macros. So you want to stop making your pancreas work so hard. Give it a break. The fourth pattern is adipose-dominant insulin resistance in fat cells. So think of this as the tank is overflowing. And what it looks like is your fasting and your post-meal glucose are both elevated, barely dropping between meals. So you're constantly high all day long. What's happening here is your fat cells are full and they're inflamed. And so they're leaking glucose and triglycerides back into your bloodstream. So the tank is literally overflowing. You have reached your personal fat threshold, and now any excess calories that you eat are going to be stored as fat in your organs. Now we're talking about visceral fat. So to fix this, you need to create a sustainable calorie and carbohydrate deficit. You also need to move daily to burn through some of that fat. You need to improve mitochondrial efficiency. So the goal here is to rebuild your system's capacity to store and burn fuel properly. So we're talking about metabolic flexibility. All right, last step, the fifth pattern is a stress dominant type. Think of fight or flight mode. And this is where your glucose bounces up and down all day long, even with a clean diet. So you often spike while you're at work without eating any food at all. And what's happening is that your stress hormones, so cortisol and adrenaline, they're pushing glucose into your bloodstream 24/7. So you're wired, you're not rested. So to fix this, you need to restore rhythm. You need to prioritize sleep, manage stress, and then you need to recover. So stop sacrificing sleep for 5 a.m. workouts. You can't out-train chronic stress. You have to address it. Okay, a major caveat with these 5 patterns is that most men are a combination of these. So muscle and liver insulin resistance, or stress plus pancreas. And that's fine. The goal isn't, perfect placement into a box. It's sequencing. So we need to know which system to fix first. That's the game changer. So here's why I think this model changes everything. It's because conventional medicine is built around symptom suppression. So if your blood sugar is high, you got to push it down with a drug. If cholesterol is high, you suppress production. If blood pressure goes up, you got to medicate it to go back down. But again, all of those are management styles. It's not reversal. Pattern-based treatment of type 2 diabetes is different. So we don't just lower the number on a piece of paper, we fix the system that caused the blood sugar to go up in the first place. And when you do that, everything else starts to normalize. Your blood sugar, your energy, your testosterone, sleep, body composition, it's all connected. Once you know your metabolic pattern, you know what's driving your numbers. So you also know where to focus, you can stop guessing, and you can finally make progress that lasts long term. Now, the tools themselves to reverse this disease don't change for most people. So it's nutrition and fasting and strength training, cold exposure, but the order of these things and which one to prioritize, that does change. And that's the difference between managing your diabetes and reversing it. Now, I don't think you need a PhD in biochemistry to start this reversal process using these patterns. You can start simple. So figure out what they are. Figure out which patterns you're stuck in right now. You can track your fasting and post-meal numbers for a week. You can see how you respond to different carbohydrates, rice and bread and grapes. That was what they used in that study that I referenced earlier. And notice where your blood sugar is highest. Is it in the mornings? Is it at night? And then if you want to get even more precise, wear a CGM and review the 24-hour patterns with someone who knows what to look for. So you don't need fancy equipment. You just need eyes that understand what those curves mean. And that's what I do with every client who comes through my program. We pull your data, your labs, your glucose trends, your daily habits, and we map out your unique metabolic pattern. And from there, we build a plan that fits you like a glove. So final thought here, type 2 diabetes isn't one disease. It's 5 different metabolic failures that all lead to the same endpoint. And that's good news because it means the solution doesn't need to be another pill. It means it needs to be clarity and then followed by precision. You figure out your pattern, you fix the actual structures, the systems that are broken, and then you give yourself a real chance at being done with this disease for good. And if you're ready to find your metabolic pattern and finally reverse what's been holding you back, book a call with me to discuss in more detail. We'll find your pattern, we'll build your plan, and then we'll get to work. Because the truth is, not everyone with diabetes wants to reverse it. Some men are fine managing it, and there's no judgment there. But if you're the guy who actually wants to rebuild his body, his energy, and get his freedom back, then let's do it right. This time, let's use precision.